on this, I'm joined now by Dr. Desmar Walkes from Austin-Travis County Health Authority. Thank you so much for joining us, Doctor.
Hi, thank you.
So first, just give us a sense of how dire the situation is right now in your county's hospitals and whether your hospitals have enough resources to get by if you do run out of ICU beds.
We are continuing to have a surge in cases here, and our ICU bed capacity has been strained. We now have 6 beds available in our ICU as we have patients moved out, but we're continuing to have a surge in cases, and our hospitals are experiencing this all over the Central Texas region.
And we've been seeing a troubling uptick in COVID cases among younger patients as the Delta variant spreads. What are you seeing there as far as pediatric patients?
At present, we have a number of pediatric patients in hospital, 12 at last count, with 4 in ICU and 3 on ventilators, and that's a big concern for us.
And largely, are these children who had underlying conditions, or they were otherwise healthy kids that are coming in?
The children that are in ICU are the children that tend to be those with underlying conditions. The children that are presenting to hospital are largely unvaccinated.
And I know that health officials try to stay out of politics most of the time, but I do want to ask you about prevention and the battle over mask mandates. How much does it complicate your job when political leaders block efforts like requiring masks at school?
It means that we have to do a really good job educating the public about the stopping the spread with mask wearing, and really make a concerted effort to communicate effectively to the public and overcome the misinformation that's out there.
What's the morale like for you among doctors and nurses, your colleagues, as this now 4th wave of COVID driven by the Delta variant surges in your state?
For many of us, it's frustrating that we're here again, and that so many people have decided not to be vaccinated, and we're continually trying to educate them to be vaccinated.
The majority of people in hospitals right now with severe COVID cases have been unvaccinated. As a health professional, how frustrating is it for you to see that with vaccines widely available? And have you started seeing that trend? People are saying that in several states that they're starting to see an increase in those cases among the vaccinated.
We are continuing our efforts to get vaccine out into our community, and interestingly enough, the numbers of those that are coming in for first doses has increased as they see that we're struggling right now with our ICU capacity. So that's a good thing.
All right, Dr. Desmar Walkes from the Austin-Travis County Health Authority. Thank you so much for your insight.
Thank you.